With the emergence over this past decade of only irradiating part of the breast, the logical question is asked, gee, are there guidelines that govern who are the appropriate patients who don't need to have their entire breast irradiated, but only part of the breast irradiated? And the answer is yes. The American Society of Radiation and Oncology in 2009 actually published such guidelines. Now let me give a little bit of background here. It ends up that with lumpectomy, and then followed by whole breast radiation therapy, and again there's 25 or more years worth of data about this, it ends up that close to 90% of the time, if the cancer is going to come back in the breast, it comes back in the neighborhood where it was originally. So therefore the question was asked, well, why do we have to irradiate the whole breast? Why not just irradiate where the cancer was originally? And over this past decade, there's been an emergence of an area or a form of treatment called accelerated partial breast irradiation. And these have been done with putting temporary devices into the breast where the cancer was, into, let's say, the lumpectomy cavity, often with what was called a balloon device, and so that twice a day the irradiation would be delivered down the balloon, and at the end of 10 fractions, or 10 doses if you were, given over 5 days, the radiation therapy was over, the catheter was removed, and you were all done. Obviously that has a huge appeal not only to physicians but to patients. Well, as the increasing use moved forward with partial breast radiation therapy, an organization like the American Society of Radiation Oncology assembled a blue ribbon team, a blue ribbon committee, and came up with guidelines for who should be receiving this kind of radiation therapy. And they created in their 2009 guidelines 3 different categories, and I've got them right here and I'm going to share them with you. One are patients who are considered suitable, and next is a group called Cautionary, and then the third was an unsuitable group. And let me go over at least now the suitable group for APBI, which is accelerated partial breast irradiation. These are patients who are age 60 or older. They're certainly not positive for the BRCA1 or 2 gene. Their cancers are smaller than 2 centimeters. They have any grade of tumor. The estrogen receptor status is positive. And what else have we got here? And the lymph nodes are negative. In other words, in this group, especially those who did not receive any what's called neoadjuvant chemotherapy up front, these are considered suitable for irradiating only part of the breast. So again, these are patients older than 60, smaller tumors called T1, the estrogen receptor positive, the lymph nodes are negative. Well, what's the middle group called the cautionary group? Well, these are patients between ages 50 and 59. Their cancers can be a little bit bigger, between 2.1 to 3.0 centimeters. The margins, again, the normal rim of tissue around where the cancer was, could be close, around 2 millimeters. The cautionary group also includes estrogen receptor negative patients, and that's sort of the sum and substance, if you will, of that group. There are a few other factors about in situ breast cancer around, etc. And then finally, the unsuitable group. And these are basically, sort of bottom line, patients who are lymph node positive, where having the whole breast radiation would really be helpful. These would be tumors bigger than 3 centimeters, women who are under age 50, if there's a thing called angiolymphatic invasion that's extensive. And in the unsuitable group, again, almost all of us in the field would not even consider partial breast radiation therapy in this set of circumstances. So in summary then, there is a set of guidelines that are out there. They are important to us, and they become important to us particularly in discussing the outcomes of patients who have undergone intraoperative radiation therapy, particularly what's called the single fraction, which is just partial radiation therapy given as one dose. And we'll have more videos on that subject later. The Mobitron is a mobile, self-shielding linear accelerator used to deliver intraoperative electron radiation therapy for the treatment of breast and other forms of cancer. To learn more about this exciting and cutting-edge technology, please go to intraoperativemedical.com.